There he is.
How are you doing? How are you doing?
There he
Oh my
is.
God,
You're
I got my teeth on this show, finally.
amazing. Listen, your new nickname is Superman.
I'm trying. I don't feel like it. I got to get the suit on because I'm tired, man. I'm exhausted.
I know, but think about it this way. Like, you're impenetrable moving forward. I
I
mean,
hope so. I hope so.
that's got to
And
be an amazing feeling.
it is. I think we still have a lot to learn. I still am kind of like not being around my parents. I do think
Yeah.
that for all intents and purposes, I'm in the best situation. It wasn't worth it. I'll tell you that.
Okay, so listen, you and I are of a very similar cloth that we were cut from. We have a
Yeah.
very similar mindset, and obviously, we want to be safe, and more importantly, we want to be safe for our patients. And
Yeah.
I know we've been talking a lot about how and what work is going to look like. Obviously, there is going to be this new normal. So, what are some of the things that you're thinking about, you're putting into implementation to be able to make your patients feel safe and your staff
Yeah.
feel safe?
Positive. Most importantly, I'm positive about the desire for people to get back to life, about to their
Yeah,
teeth, to their skin, to their Botox or whatever. And I just
yeah,
think, like with every other aspect, it's going to be staged. I think you and I are going to
yeah,
be working at a quarter of the volume to start. Maybe after a couple of weeks, half the volume. If we're lucky, we're going to ramp it up. We're going to spread out our staff, most importantly for their safety. We're going to spread out our patients. And we have to take it easy for our safety too, because people are going to come in understandably stressed. They're going to project that stress. And,
yeah.
I just think it's going to be like, take it slow, step by step. It's not going to be the light switch. Although I do believe the demand is going to be there. I just think people want to get back to life.
Yeah, no, I agree.
I
Yeah,
mean,
what we were talking, yeah, tell me, go ahead.
I was going to say, do you foresee? I mean, I'm clearly wearing a mask even when I inject people, not just during liposuction and lasers, but I'm clearly wearing a
Yeah,
mask indefinitely now. I mean, is there anything
yeah.
about your universal precautions that you think are going to change? Because as a dentist, it's a little bit more risky, right?
Yeah, I mean, look, it's risky no matter what, right?
Yeah.
But obviously we're spraying up aerosols and things like that. I mean, I've seen some pretty drastic measures that some people are talking about taking. I don't think that they are realistic. I've seen that box
So
go.
you were talking about testing and how we
Yeah,
can get back. And I think that's
yeah,
key. One of the points I wanted to make, because antibody tests are going to be useful, but you know what? We still have to have, what's most important is someone actively infected? And what we
right,
mentioned before, I think it's going to be really important for all healthcare professionals to partner up where they can. Like I said, you and I
right.
do bigger types of cases. So you want to make sure that the patient's going to have a good reaction. They're not contagious. So having relationships with other like primary care doctors so that patients could get tested quickly. Hopefully we'll have faster molecular tests too.
Yeah, I mean, that is going to be key. I think that's going to set everyone uh, at a comfort level where they'll really, look forward to coming back. Because at the end of the day, even I'm saying like I want to get back to feeling good again,
Yeah. Yeah.
beyond my routine, and I feel like a lot of people feel that way, and therefore those that are watching in the kind of healthcare provider spectrum, cosmetic dentistry, cosmetic dermatology, regular dermatology, it's got to come back. I mean, I
It
have
will.
hundreds of patients that are just, we have to adjust their bites, they chip
Absolutely.
teeth, cavities.
Absolutely.
I mean,
Absolutely.
it's a necessity.
You
So
know, you know what? I really think what you're saying, we have to look at on a broader spectrum, much like I have to with my own disease. Right now, I'm healed. I feel better. But again, I have to have low expectations and high hopes because I can't get on my Peloton. I can't work out like I used to. And I think
right,
with our practices too, yeah, we want to get back to normal. We want everything. Everyone wants to go to restaurants, function, eat, consume, be happy, be intimate. But I
yeah,
think we have to keep our
watch
expectations.
sports.
Well, not for me, but I think we have to really regulate our expectations. Not that things can't be great again, but
Yeah,
we have to take it one step at a time, and it's going to come with frustration in our practices. It really is, because when
yeah,
people are under stress, who do they project it onto?
yeah,
Our job is to do our job well, give safety, and manage people's expectations. You know what I mean?
yeah, yeah. Um,
how do
you
you
know,
feel
right.
about about the whole international thing? I know you practice in Dubai, in LA. Do you foresee travel, or being an issue? Have your international patients reached out to you?
Um, you know, first of all, in Dubai for you know, by itself, it's hard to know anything because you're not dealing with a democratic government that's giving
Yeah.
real answers to what the possibilities are right now. Like, I have no idea when we're flying back into Dubai, especially, but Europe. I mean, it's going to be tough. And,
Yeah.
and I have a feeling that just like when after 9/11, what we encountered with boarding a plane, which was, the biggest hassle in the world to everyone, going through metal detectors like that and all the security. I mean, people don't remember because my wife was saying, like, people's memories are so short, but
Yes.
people don't remember getting on a plane pre 9/11 was like you just kind of walked on a plane. There
Absolutely.
was there wasn't all of this security that there is now. The dogs and the.
The
So
shoes.
yeah, I think there's going to be some measure that they're going to have to put in place to allow travel because just think about, the world has come into this global economic
Yeah.
state
Yeah.
to where it's going to want to reopen. The airlines are going to,
Yeah.
tourism. It's all part of the world surviving at this point. So
What
it's
about
going to come
refitting the
back.
planes?
The question is when,
Yeah.
right?
The refitting of the planes. If
Yeah.
you look at now compared to 20 years ago, the seats are so much closer, they're so much
Oh yeah.
smaller in every class. How
Yeah.
could they not revert to creating more space so people aren't on top of each other?
Right.
They have to re-outfit the planes. There's no
Right.
question. And
Right.
restaurants, I mean everything, our waiting rooms, you know?
Yeah. Yeah.
I love it when all my providers are at full steam and the waiting room busy and everyone's running around and bouncing into each other. I don't
No
know.
one's going to feel good about a full waiting room these days. For
No,
sure.
no. So I think
Yeah.
part of our job as healthcare providers is to really, whether it's cosmetic or not, part of our job is to ease people's worries because ultimately our environments should be the safest place to be, right?
Right.
Our staff
Right.
is used to universal precautions. I mean, listen, I know doctors that pick their nose when they're in the hospital, so it's very tough for lay people, in grocery stores and people who drive buses. It's very difficult for them to navigate what appropriate, protection is about.
Yeah. Um, pre going into this whole thing, I was having long talks with my staff before, the city and the country got locked down. And that was, I wanted people to feel like this was a safe zone that they could come to, that they knew that everything was as safe as it possibly could be. And that's what medical offices really should be. So when we were talking about before wearing a mask or not, before we got cut off, you know, I have those fancy lab coats and I love wearing nice clothes to work. Like there could be I'm wearing scrubs to work with the disposable gowns and the masks and the face shields in the beginning, and
Yeah,
and we'll see.
yeah. It's funny. My dad, who I think I've told you, is a general practitioner. He's been practicing 45 years in Brooklyn. He tells me stories
Yep.
pre-AIDS or being in dental school in the 60s. No gloves,
No
no
gloves.
gloves,
Yeah.
blood,
Yeah.
drills, no mask, no
Yeah.
gloves, and being
Yeah.
engrossed in
Yeah.
that anatomy class, eating sandwiches. If my dad's
Oh
watching,
yeah.
shout out. I remember that story, Dad. I mean, it's
Yeah.
crazy.
Yeah.
There will
Well,
be
I mean, even when we were in dental school, the gross anatomy professors would come over with a sandwich in their hand and the tongs, and they'd be pulling, like veins and blood vessels to show you, and they'd be,
yeah.
it was like nothing to them.
I
So,
know. Maybe
look,
my son,
it's
when my
it.
son, if he becomes a dermatologist, he'll be like, "Can you believe my dad didn't wear a mask when he did injections?" Yeah.
Right,
He
right.
used
I mean,
he.
today
Go ahead.
whenever I post a video with no mask on, people used to chastise me.
Yeah.
But part of that is like, the other part that we can't forget about, and I'm sure you feel this way, but like, I'm a very, as a healthcare provider and as doing what I do, it's a very intimate setting being a
Absolutely.
doctor, and
Absolutely.
I miss touching people. Like,
I
I
know.
miss the fact of being close and touching people, they were asking, like, is this the end of the handshake? God, I hope not, because putting my hand on someone's shoulder, touching someone, like, you miss
No.
that intimacy
I
that we
hug and
have as
kiss. I
doctors.
hug and kiss my patients. I see them several times a year. I've known
Yeah.
them for 20 years. I know their bar mitzvahs, their deaths, their weddings. I know all this stuff. And you know what? Even when I wear a mask, it's very, they want to see my smile. Patients
Yeah.
are they're looking at if their eyes aren't closed, their eyes are open, they're looking at me. It's like watching a stewardess during turbulence. They want to make sure
Flight
everything's
attendant.
okay. Oh,
Flight
sorry.
attendant.
So, excuse me, flight attendant.
Yeah, but
But
that's the point is how do we get back to, because look, in treating people, part of what we're doing is not only fixing their cosmetic issue, you're also you have to bring some level of calm and that feeling that people get when even when I go to a regular my GP, right? The way that he makes me feel when he says you're healthy, you're all good, like you just feel like, okay, good, I'm good. Like
yeah,
you wanna give your
no,
doctor a hug or a handshake, and but suiting up in what we may have to do in the near future is very impersonal. It's very scary. It adds to the it adds to the paranoia of what's going on. But unfortunately, in the beginning, I don't see a way around it, and I think
no.
it's going to be a necessity.
No, because ultimately we want to provide the service. The patients want the service. And you know what? We'll do what we have to do. I know we
Yeah,
will. Whatever new level of normal we'll find, we'll do it. And I'm confident that guys like you and me, who are always ahead of the curve, staying on top of things, that we'll find our stride pretty quickly, you know?
yeah, yeah.
So, and that's it, my
So,
friend.
closing words.
Closing words, man. Stay home. Stay home. Don't think you're immune, man. Don't think
Yeah,
you're immune. I went through it. I really feel like I dodged a bullet. I'm so grateful. But you know what? I can't wait to get back out to work. Right, but I opened up my practice a month before 9/11, and I thought
yeah,
no one would ever get a chemical peel or a collagen shot again. And woe is me. I started from ground zero. I don't feel that way now. I think it's all going to be
yeah,
okay. I think it's going to come with trauma. I think it's going to come with pain, and we've lost a lot. But I think
yeah,
not only just us, but I think we're all going to be okay.
yeah. I agree.
All
Paul,
right, my
always
friend.
great talking to you. I look forward to
Always,
working
man.
together in the future.
Okay, I'm
Stay
coming in.
healthy.
I'm coming in.
Looking good.
I'll
Looking
see you
good.
later.
Here.
Bye. Yeah,
See
exactly. I'm coming in.
ya.